Ebola crisis. Earlier this morning, I spoke with Brianna Aguirre and her attorney, Bob Kelley. Brianna is a nurse who works at Texas Health Presbyterian. She's the first to speak out publicly about what she says was a lack of planning, protocol, and precautions. I would imagine when you have a possible Ebola patient walking into an emergency room, given all the attention that had been paid to the Ebola crisis in West Africa and the fear of it coming to the United States, that it would be some kind of code red, that there'd be a lockdown, that emergency protocols would be put immediately into place. Is that what you experienced?
Well, first, I think we all have been watching too much TV because we never talked about Ebola, and we probably should have.
You never talked about it prior to Mr. Duncan arriving?
No, we never had a discussion. They gave us an optional seminar to go to, just informational, not hands-on. And it wasn't even suggested that we go. It wasn't, something that they said, you really should try to make it. It was, I believe, only offered once, if not twice. We never were told what to look for. And I just don't think that any facility in this country is prepared for that at this time.
So when Mr. Duncan came to the emergency room, a possible Ebola patient, where was he placed? What kind of procedures immediately kicked into gear, if any?
First, let me say I was not a nurse that cared for him, and so I only know what my coworkers told me, people that were in direct care of him, people handling his lab specimens. I was sitting next to the doctor who was in charge of his care that day, and all I know for sure, without any speculation, without any, without being misleading here at all, is that he was put into where there are up to 7 other patients. We took probably around 3 hours to make our first contact with the CDC to even let them know that what we had as our suspicion. There was no special precautions other than what we know in the medical industry to be, basic contact precautions and droplet precautions. There was no special gear. We were unprepared in the sense that we did not know what to do with his lab specimens. They were initially mishandled, and that's what the lab technician told me. And it was just a little chaotic scene. Our infectious disease department was contacted to ask, what is the protocol? And their answer was, we don't know. We're going to have to call you back.
I want to talk to you about the protective gear that you initially wore. You did care for Nina Pham, your colleague who contracted the virus, while she was caring for Mr. Duncan. And you described to me on the phone the equipment you were wearing. There was a shield and a mask, and there was some kind of a gown that covered your arms. You wore gloves and booties over your shoes. But there was a glaring difficulty or problem. There was a gap in your protective gear at your neck of several inches where your skin was exposed. Is that true?
Just to clarify this very complicated story, initially we were advised to wear a gown front and back. By the time that I even partook in the Ebola situation in my hospital, we were already wearing what I guess would be hazmat suits. They were Tyvek suits. They were DuPont suits. And it was basically, just like you would have in a snowsuit or any hoodie, it would zip up to about here. And then from there, it would go into a hood up around my face, like this, around my whole face. And then on top of that was a mask in front of me that would go under my chin to here. So from here to here was uncovered.
And that concerns you, and you complained about it, or you at least asked the officials at the hospital why that was being allowed to happen, correct?
In fact, I'll just be honest, I threw a fit. I just couldn't believe it, and the second week of an Ebola crisis at my hospital, the only gear they're offering us at that time, and up until that time, is gear that is allowing our necks to be uncovered. And I just flat out asked several infectious disease nurses, I asked the CDC, why? Why would I be wearing 2 pairs of gloves, 3 pairs of booties, a plastic suit covering my entire body, and then leave my neck hanging out this much so that something can potentially go close to my mouth or nose.
There are a lot of other hospitals in the Dallas area. Texas Health Presbyterian could have put a call out to those other hospitals saying, do you have the suits that protect the entire body? Why don't you think they did that?
I'm not in administration, and I'd only be speculating. I'm someone, I guess you would say, is at the bottom of the totem pole here. I only know what information trickles down to me, but I actually posed that same question to someone who identified himself as the vice president of our organization. I asked him, then good, you're the vice president, you can go and ask for the supplies that we need. And he advised me that he would call me back. I asked him for a contact phone number so that we could call someone more at the top of the totem pole here and ask them, for direct things that we need. Because it's not just that we were missing. He said he will call me back with a phone number that I can reach help with. And he never called me back.
Brianna, you, I mentioned, worked at this hospital and have worked there for 3 years. You love your job. You're not a union member. In Dallas, there isn't that nurses union. You're now saying things that are going to make a lot of people at that hospital look very, very bad. Are you worried about the fallout here? For you personally?
And I just want to say that I'm sorry for my coworkers. I know that a lot of you will be proud of me right now, and I'm sorry for those of you that are not. But what I'm doing here is not wrong, and I don't believe anyone can argue that. And I'm very concerned about losing my job. It's the best job I ever had. I travel a great distance to work there. I don't live close to that hospital. I'm the breadwinner of my family. I'm terrified. I'm just like any other, the majority of middle class, working class people. I'm just a couple paychecks away from not being able to pay my mortgage, and I'm terrified about that. I don't know about my future there at that hospital or at any hospital.
Bob, does she have any protection?
Well, Matt, as you know, we're doing everything we can to protect her. She's what would be commonly known as a whistleblower, and we have a history in this country, these companies, when somebody comes out like this and blows the whistle on what's really going on, of retaliating against them. So, she's got a 7-year-old daughter, a 10-year-old daughter. She's the breadwinner in her family, and our law firm is doing everything we can to protect her at this point. But it's my hope that after the American people hear today what's going on at that hospital, that the country will come behind and support her.
Brianna, finally for you, you're in that period where you're monitoring your temperature a couple of times a day, although, as I mentioned, there are no restrictions placed on you moving around right now. But if, and I don't, this is hypothetical, if you were to start to experience symptoms of Ebola, Texas Health Presbyterian Hospital would be the recommended hospital for you to go to for treatment. How would you feel about that?
I've played that situation out in my head. And knowing what I know, I would try anything and everything to refuse to go there to be treated. I would feel at risk by going there. If I don't actually have Ebola, I may contract it there, is how I actually feel. And I would do anything to refuse to go there.
Brianna Aguirre.